Factors we have found that have played into this is gatherings in homes for things like birthday parties, for funerals, and for Bible study groups.
We've continually heard about how coronavirus is spreading and where new cases are emerging from. But how do we actually know this information?
Hello?
Hi, this is Hiba. I'm a contact tracer from Yolo County Public Health.
This is the phone call you'll receive if you've been exposed to COVID-19. It comes from a contact tracer.
Contact tracing is very important. It's very important because this virus it spreads fast.
We need to isolate infected people so they don't spread the disease to others.
Contact tracers are the individuals who are actually tracking the spread of coronavirus.
It kind of sounds like a little bit of like a disease detective.
Yeah.
But this line of work isn't anything new. In fact, public health departments use it for a number of diseases.
We do it for things like meningitis, for gastrointestinal diseases such as Salmonella and E. coli.
Syphilis, HIV, and TB.
But as the coronavirus pandemic set in, contact tracing has become more and more relevant.
There's never a dull moment doing this work.
Here's how it works. If someone tests positive for COVID-19, that individual's name and phone number is entered into a database for contact investigators. The investigator is often the one to inform someone they've tested positive, and then they'll ask about where that person has been and who they've been around.
Where they work, if they go to school, who are their friends, who stays in the home.
That information is sent to the contact tracer.
Then the contact tracers warn the exposed individuals.
We don't tell them who we got. They've possibly been exposed.
The contact tracer reaches out to the people who've been around the positive patient and asks them to isolate themselves.
If we're seeing the cases coming from a certain business sector or a certain venue, then we can go to that venue and make sure that we take measures to stop the spread.
If I receive a call, how do I know that it's valid?
First, we reveal where we're calling from.
We don't go into all those social security numbers. We don't go into credit scores or anything like that.
And then we also only ask them for their date of birth and their address and their names that they identify with. We also ask for their race, ethnicity.
All information is confidential, and as society begins to reopen, these tracers are getting busier and busier.
Contact tracing is more important now because we are seeing places, at least in California, start to reopen and people are moving around more, and that it doesn't mean necessarily just because places are reopening that this virus has vanished or that it's not a concern anymore. We still have to be careful.
That's why the state is currently working to get 10,000 tracers activated with an overall goal of 20,000. But how are they doing that?
It's all new to me too.
David was initially working as a health educator in a different branch of Yolo County's health department.
It's been challenging, but it's been really rewarding too.
When the coronavirus pandemic hit, his team was one of the first to be deployed to contact investigating and tracing. He's now co-leading that team. Redirecting government employees to conduct contact tracing isn't just happening in our neck of the woods, it's happening at the state level. The California Department of Public Health confirmed that more than 90 departments on the state level are allocating 5% of staff to the contact tracing team. But not everyone is happy about it. A state employee who asked to be kept anonymous said, "We're being told we have no choice in the redirect and may be subject to discipline if we do not comply in performing contact tracing that a lot of us have no interest in doing. A lot of us fear retaliation if we don't comply. I myself never felt owned by my government until now." Labor law experts say it is legal for these employees to be mandated to do a job outside of their own, due to two things: their civil service classification, as well as the current state of emergency we're in.
The state of emergency, if you will, that the state is in, also gives the governor and state agencies and what's called the appointing power. The appointing power is the actual agency or the state of California or the department that is making the decision to be able to say, this is how we're going to redeploy you.
And for many government employees doing work within the health sector, the social skills needed for contact tracers may closely relate to their initial role.
They're making phone calls they're keeping track of data, they're analyzing information. So even though it feels like a different job, the actual skills that are necessary are not much different than from any other state jobs.
Anyone we take onto our team has some background in calling clients and serving them.
It's all part of slowing the spread of the coronavirus.
It's been very rewarding. It's been rewarding to see, just to consider the possibility that we're saving lives.